Budget hearings continue today, Friday, May 9th. Excited to have a couple really wonderful presentations. Let's get to work. Lorian, take it away.
Okay, we'll be on page 581 of your binder for the Division of Public Services. I'll hand it over to Tim Kaufman.
Okay, thank you. Good afternoon, Chairman and Commissioners. Thanks for this opportunity to discuss Division of Public Services requests today. You're going to be hearing from myself, from Joan Tammany, and from Chris Stewart on behalf of Adrian Byrne, who's under the weather today. And I'd also like to acknowledge the work of Jeanette Livingston, Monica Sissel from Aging and Disabilities, and the department and finance staff, including Lee McCrae, who is our budget analyst, for helping put this presentation together. I wanted to start with a high-level division workforce slide. And while this is not as attractive as some of the slides that you've seen from other departments, I'm really pretty proud of this because we have made tremendous progress in the last few years, thanks to the work that HR and finance and you as a commission have done towards wages, because it's really made a difference in being able to fill positions. 10 years ago, when people asked me, what do you worry about as organizationally? I said, finding a capable, adequate workforce. And it continues to be a challenge, and it probably will be, because the folks that work in this division are often licensed, or they have specialty education and experience that's required by a third-party payer, whether it's Medicaid or insurance companies or state agencies that do regulatory work. So the challenges to find people in this field continue to exist, but I think we've made a lot of good progress, and the departments are partnering with HR to continue to find quality workforce, and I'm proud of that. I'm going to cover the community programs budget. That's part of public services. There is one expenditure at this point in time. It is a non-mandatory expenditure, but it is support that we provide to the Child Advocacy Center. I think you're probably all familiar with the important work that the Child Advocacy Center does and the strength that comes through a coordinated multidisciplinary approach to this very difficult task that they've taken on. In terms of weaknesses and strengths, fundraising, whether it's private fundraising that they do or fundraising from public entities, is a challenge. It seems to be getting more difficult to raise funds as we go. And then some of the uncertainty, they receive federal grants. Some of the uncertainty in that area are some of the weaknesses that they face. But the opportunity that they have is to continue to partner with other organizations and expand their base and continue to do that good work that they do. The budget request is $218,000. That is flat from last year, same amount. It is a contractual payment that goes to them, and there are no decision packages, alternatives, or revenue for them. Any questions about CAC?
So Tim, we just support one organization and community programs. That's it.
That's it. Okay. We have funded different organizations over the past number of years that drop in and out, but Child Advocacy Center has been the consistent one in that regard. So if there are no other questions, I'm going to invite Joan Tammany up here to talk about CommCare.
Well, hello, Joan. Good afternoon. Welcome.
Hi, good afternoon, Chairman, Commissioners. Always nice to share information about CommCare during the budget season. But I do have a couple of things I just want to acknowledge a few things at the beginning. So it is Mental Health Awareness Month, and so I just want to make sure that the public and staff internal to CommCare, not CommCare, but the county, know that. And it's a focus this year on self-care and well-being, and making sure that we're checking in with one another and trying to continue to break down the myths and the stigma that's associated with mental health. I am excited because, again, this year the county has chosen to light up the historic courthouse with green in honor of Mental Health Awareness Month. And so if anybody's driving by at night, it's a beautiful sight when the courthouse is lit up in different colors. We also worked with communications on a debunking mental health myth project. So we have 5 of our direct service providers who are responding to a myth and sharing a brief statement as to why that myth is not factual. And I will say that our staff love doing that, and it's exciting to see them involved. And the first one was released just, I think, yesterday or the day before. I will say, been traveling this week, so it's been a long week. And if my words slur, I'm sorry. It's one of those times when you're getting a little fatigued. But we were at our National Council for Mental Wellbeing annual conference, and it is huge. We get 5,000, 6,000 other mental health leaders together and hear from experts in the field and national experts with regard to legislative process and what's going on at the Capitol. And I'm sharing that because no matter who we spoke to or no matter what session we went in, we were ahead of the game. So while we talk about gaps here in Sedgwick County, we have fewer gaps and more service options and more talent than most other states in the nation. And we're recognized in those meetings as being progressive. And it's just exciting to be validated for the work we do. So, and then finally, I just wanted to say that I invited my leadership team. A couple of them has expressed in their personal goals for this year to get more involved. And while they have access to the videos after the fact, I thought it'd be fun for them to be here in person and experience that with each of us. So with that, I'm going to move into, and I did give you a few little trinkets. I gave you for suicide prevention, a wristband and a pin. And a little squishy ball. Chairman, I gave you 2.
Thank you.
Because I know you fidget with things in your hands.
A lot of nervous energy. Yeah.
It's good. I do too. But if you don't want them, pass them along to somebody else that might need a little uplifting moment in their day. So thank you. With that. So here is our workforce strength, and you can see that we're in the red. Which means we're below 80% as a total and a whole as an agency. I will say that is dropped from last year. We were at 82%, but in 2023, we're at 62%. So we've lost some gains, but we've also added positions and gotten grants where positions were added to that. So some of it is because we have vacancies that aren't filled for new projects and partnerships that we're engaged in. Where you see the red most is in our children's program and our crisis program. And as Tim spoke to, we need talented workforce. So it's not for everyone. And then when people get into our work, it's hard. And it's complex, and the population we work with is challenged with a lot of resource limitations and personal trauma that sometimes brings a level of resistance that a lot of people who go to school with the ambition of helping others have a hard time understanding how to work through. So we continue to try to do a lot of creative things to recruit. We use our workforce to promote the joy of working in public service. We utilize any resource we can through HR. We utilize any social media platforms we can, but I sure would like to see that get back up into the 80s, because you take out 5, 10 positions and it makes a difference in terms of access. Okay, so when I speak on this page, I'm speaking only to the services that are funded through general fund. These aren't all our services on the mandatory and non-mandatory services, but these are the ones funded through tax dollars. So those that are mandatory or outpatient service administration, those are folks overseeing those services, and we have to have the infrastructure and operations to do our work. The non-mandatory tax programs are our mobile crisis response, ICT-1, 18th Judicial Court, administration for addictions, and then our offender assessment program, which is one of our jail diversion programs that was funded years ago in response to the Criminal Justice Coordinating Council to reduce the number of people with mental illness who engage in nuisance crimes going to the jail. And it's very effective. But those are our general fund positions. Everything else is in the revenue fund. So I could have made 3 pages for the SWOT assessment because we've got a lot going on in our field. But I think the highest strength for us is we have an incredibly talented and compassionate workforce. And that's what makes us get what we're doing done. And we have a full array of services, which a lot of communities don't have 24/7 services. They don't have mobile crisis response. And so we have greater access for people in our community to get help when needing services. We also are very aggressive in using quality improvement work groups within our organization. So if we identify something that needs attention, we don't sit in a room and try to figure it out as a leadership team. We engage stakeholders in that process, use short-term work groups, and then implement the changes. And we course correct as we need to. And we have just an abundance of staff and leadership involved in community engagement activities. We track what we're doing, and we're engaged in over 112 different coalitions, work groups, boards, et cetera, in our community. So we're well represented. With regard to weaknesses, we've already spoken to it. Our constantly going to be our biggest challenge is staffing challenges. There's just limited talent. And when we talk about that, one of our threats is all these new for-profit entities that are entering the market, and then soon to be a state mental health hospital with a need for 368 employees. We're a little anxious about that. We also have weaknesses when it comes to facilities because most of our buildings are leased, not owned. But that's also an opportunity for us. So I do know that we have a challenge hiring after-hour and weekend staff at our crisis center. We're not a preferred provider because it is 24/7 with regard to that. And a lot of people since COVID really don't want to work alternate shifts or give up their weekends. It's just a different workforce challenge than we had before. So there's several other things on there, but opportunities. I mean, we got to highlight the crisis center. That is an opportunity to brand that service in a new way to make it more accessible. And quite frankly, the biggest motivation for that is we need a therapeutically inviting environment for people who are experiencing a psychiatric or substance use crisis. And this will provide us that opportunity where I think more people will be comfortable walking in those doors and seeking help when they need it. Hopefully we can get more people triaged and served earlier than always at the last minute when people are really struggling. We're also focused on growing our medication-assisted treatment, and that is designed to help those who have an opioid dependence. And it's a very intensive protocol and a prescriptive protocol, and it's medication and medic staff driven. So we're growing that. And, the other thing that's really cool is we pay into a data warehouse at the state level for all of our CCBHC data to be compiled collectively as an aggregate to show the strength of the CCBHC system in the state of Kansas. And then we'll also have access to our own data to show our availability in terms of strengths. That is still up and going and a work in progress. The threats, I think, I'm not speaking to anybody that doesn't know the threats in this room. I mean, we have all the new executive orders that are coming out quicker than we can learn what they are. Tariffs, we're already seeing surcharges on purchases for technology and other stuff where, we don't know what's going to happen with Medicaid. That's a big driver for mental health services, and the committees in Washington are tackling that issue right now with an intent to reduce a significant amount of dollars. And we're just hoping that we're minimally scathed by that and can continue to do the work and the stuff that we have worked so hard to gain in the last few years. And then I have that one on the bottom. I want to share what that is. Perception as a government entity or department. that is not a critical statement. That's a statement that a lot of people are being laid off in government. And people are anxious. I mean, our own staff are anxious about, are we going to be laid off as funds get cut? And so that is driving some conversation as we're interviewing and talking with potential new employees. So every year we add this screen, and I think this year it's even more important for our new commissioners to understand where ComCare's funding sources come from. If you look at the circular table, orange is our largest driver of funding, and that is our fee-for-service. That's not our fee-for-service. It's our Medicaid reimbursement. And our insurance reimbursements. It's what we get paid to deliver the services. So you could see that hits us at about 65%. And our other financial driver is our contracts with KDADs, most of which, fortunately, are state general fund dollars versus federal pass-throughs, although we do have some pass-throughs like for 988 and that sort of thing. But together, those account for the bulk of our revenue sources. You'll see that county support hits us at about 7.25. And again, I talked about that when we talked about mandatory and non-mandatory services, that hits several positions in administrative roles and support roles. It also hits our Sedgwick County Offender Assessment Program that does those jail diversion population. And then it also supports ICT-1 and some of our addiction treatment services. So that's an important component of what we do as well. You'll see at the bottom that our property tax funded positions are about 52, where our non-tax funded positions are much higher in the 500 range. Okay, so here is our budget request. You'll see that the total for 2026 is 71 million. I want to talk about the changes, the ones that have the change elements in it. So the ComCare Revenue Fund, that we project to go up because our prospective payment encounter rate went up effective 1/1/25. So that means we get more for each service that we deliver. And so we project about a $8 million increase in our revenues as a result of that PPS change. The other change that's significant is the drop in the special alcohol and drug program. That's not a service line. Those are funds we get because people buy liquor outside the Wichita region, and that number is provided by a finance to us each year, but some of that comes back to us through these special liquor tax funds. And then our housing grants have dropped because the continuum of care funding for Shelter Plus Care were reduced this year. This screen with regard to our budget request, you could see that the bulk of our budget goes to staff. The others go to contractuals, is our other big driver. And the reason that has increased for 2026 is, again, we have that increased prospective payment dollar amount for each service we deliver, but we also have needs for electronic health record, enhancements to keep driving our business. County admin charges increased from, I don't remember the number, 7 point something last year to 10% for 2026. That it captures the school tuition program, which is our Grow Our Own program. If you remember, last year you supported some additional student positions so that we can continue to grow our internal pipeline of master's levels clinicians. And I want to tell you that we already have 2 graduates who have moved into clinical positions, one at Crisis and one at Children's. We have a third that's graduating in, I think, 2 weeks, and she is going to become our mental health court clinician. And then our last two from that first cohort will graduate at the end of summer. And they haven't yet identified what role they're going to. But if you remember, you guys approved an additional 6 for us. So this year we intend to build that pipeline even further and have some in advanced programs where they'll graduate in a year and then the rest will graduate in 2 years. So we're working hard in that retention and recruitment component. And I will say the staff that have gone through it are so appreciative and have such significant loyalty to the county for allowing us to do that and grow them and pursue their dreams. This year, we're hoping to get some that will become dually licensed in both mental health and substance use. It also captures the increased payments we will make to affiliates this coming year as a result of that rate change. There is some carryover funds from one of our federal grants with our CCBHC. If you remember, we got a 4-year grant, $1 million a year that supports some of our positions. We have carryover from a previous year that's incorporated into this. It's our data warehouse and CCBH management fees that we pay to the Association of Community Mental Health Centers for the back end work they do for us as a CCBHC. And then there's also $1 million increase. If you remember when I presented the crisis contract last year, we got an increase of $1 million that will be incorporated in this. I will say I'll be coming to you soon with our contracts for this upcoming year. And when we submitted those grant applications that you guys approved, we got a significant return on the time and investment, and we're moving to $4 million to crisis services versus 2.5. And then we also are anticipating an increase in our 988 funding from KDADS. The difference in our commodities, quite frankly, we're heavily driven by an electronic health record, which requires us to have current and effective technology. And we are at the end of life for a lot of our hardware. So this is equipment replacement, and then also some anticipated costs as we move toward the crisis move. Any questions on that particular page? Okay, and then ComCare does have one decision package. I think we've talked about care coordination and the importance of care coordination as a certified community behavioral health clinic, but it is a mandatory component of what we do. It literally serves as our linkages. So if somebody comes in and we identify that they have a physical health need, for example, that person, those care coordinators will help get them hooked up with a medical provider in the community and then try to follow them to see that they follow through with that appointment. They help with garnering transportation for our folks that frequently no show because they don't have that capacity to get to appointments, relying on the bus line. Or a friend who may have something come up and no longer can transport you is difficult. So they help with all those social drivers of health and that people struggle with in services. So we only have a limited number right now, but we have to, one of the CCBHC requirements is that care coordination is available to all. So this will help us get closer to that goal. And I will say that for me personally, this is what will distinguish ComCare as an effective and successful CCBHC versus just doing adequately, because it is all about making sure that we're wrapping supports around our population and getting them connected to their necessary services in the community. That request is for salaries, benefits, and other related costs for those positions. That comes to a total of $812,229. It's 10 FTEs. We're not asking for funding through tax dollars. We believe that the money we make as a CCBHC through our prospective payment services contract is intended to be reinvested in helping this population. And this is where some of those funds could be done. And we do believe it will increase the emotional well-being of our population. You know, if your basic needs aren't met, treatment is going to be difficult. That is the only decision package we have, and I am open to questions.
Okay, thank you. Always appreciate the presentation. There's a lot going on. Palm Care. I have a few questions, but I'll open it up to the other commissioners. If you have some questions, Commissioner Howe?
Thank you, Mr. Chairman. And John, thank you for the update on everything. On the SCOPE program that's down on Central here,
Yes,
is that trying to remember, what's the status of that right now? It's been increased and decreased a number of times. What is the status of that program right now?
it's stable. We really haven't shifted much in the past several years. That is part of our crisis continuum, so they will merge because we have our crisis stabilization in that facility as well. They will merge into the new crisis center when we move there in 2026. But in terms of funding, that comes through tax dollars, and you guys have been pretty stable in supporting that program.
Is there a waiting list for folks in the adult detention that are qualified to be in SCOPE? There's not space there.
I don't know of a waiting list. I certainly can get back to you on that, but I haven't heard of a waiting list.
I've talked to corrections, I believe. In the past, there has been a waiting list. And one of those things I was interested in is it's less expensive to the taxpayers to have them in the SCOPE program than it is in the adult detention facility. And it also helps them get more, transitioned into the private sector more safely by having them in that program versus something more abrupt, if you will. So I guess I just like to know if there's still a waiting list in the adult corrections. I think there was in the past, and I don't know if there's.
I'm looking at Jen and she's saying no.
Okay.
We have same day access to intake people into services, and I have not heard of a wait list in a long time.
All right, great. Thank you.
Joan, the care coordination positions, what are the credentials for someone? What are you looking
They
for?
have to have a bachelor's level equivalent and a strong interest in this type of work, because you're literally chasing down people who may not want to engage in services. You're trying to motivate them to get invested and do well.
Okay. I do understand the tension with what's coming in the ecosystem and staffing. And I think we're going to have to get pretty creative on how we meet some of these needs. And particularly in children's, I saw the chart on the children's side. Do we do much partnership? I know we as a county invest into child psychiatry programs at KU Med to try to build our own. When I first got here, I think there were only 6 in the city of Wichita. I think we're up to 10 now. Is that?
Yeah. So we have 3 fellows.
Okay. That was
we nurture 3 fellows. And if you remember earlier last year, you guys approved an employment agreement for Dr. Thiagala,
yes,
who we worked on to get a visa waiver, and she will be graduating this summer and joining our staff in September.
great. Okay. I just wanted to hear that update. That's
and then
great.
we'll get 3 more next year, and we're adding an addiction fellowship as well. So that is going well.
Thank you. Okay. One of the things I hear about in my district a lot, Mays and Valley Center, and obviously Wichita Public Schools, is the MHIT teams.
Yes.
There was some fear. I had a legislator that had retired, reached out and thought there was some fear with the grant for the mental health intervention teams.
Yeah.
How do we feel about that grant? And is that program still?
Yeah, the program is strong. I mean, we serve over 1,000 kids a year. We're in up to 52 schools in our district, but I will say they did legislatively this year take $2 million from that program to support getting telehealth from an outside provider. So probably somebody outside of Kansas. And we don't think that's the best because it's not seeing somebody in person and you're not wrapping the same support.
We might circle up with you as we're figuring out our legislative agenda, Tim, to talk about that MHIT grant. And I have scores and scores and scores of teachers and social workers in the schools in my district that talk about the impact that the MHIT people have had in our schools. And Chantel's helped tremendously with me understanding that and communicating to the schools in our district. So we might circle up to figure out there's some legislative discussions that need to happen in supporting that. Yeah,
or at least maintain it. We were disappointed this year because we had advocated heavily to get that put into legislation versus every year going back and fighting for those dollars.
Yeah, well, I appreciate that. Just 2 comments, and I just want to give you a heads up. I'll be reaching out. I just finished Starkey's board meeting, and Deputy Secretary Bruner was with me there, and he's coming over here at 3:00 to have a discussion about IDD and mental health crisis stabilization. And so we're going to lean into you to pick your guys' brains in particular. Joan, about just what do we need to know in some of these things and how we're going to get creative. And some of the other one is the homeless conversation in the MAC is trying to lean into your guys' expertise. So there's not a question there. It's just a
Yeah.
comment that I think the community's going to need us to pivot. We're going to need ComCare to really help us in this regard and lead in some of these things. So we're going to leaning into your wisdom on how we meet these needs here pretty soon. So that's just a heads up. I'm going to be calling and coming over and
Well, we
picking
have,
your brains.
our staff have regular conversations with Jeanette
I know you do.
and the STAR model, and Jen's on that advisory board with Jeanette. So
No, and I appreciate that you have leadership with you today because they're really involved in these processes. So that's all I got. Any other questions?
Thank you, Chairman. Back to the package request, request for 10 additional. So you have 11 now and you're asking for 10 more. That's almost a doubling of staff. Does that mean there's a large number of patients that are not getting their care coordination right now because there's nobody to do that?
correct.
Okay,
And there's a need.
okay.
Because if we don't have care coordination done by care coordinators, it falls on providers who are delivering direct services to do that work, and takes away capacity to see patients, to deliver services.
Okay, so if the care coordination is more complete, I guess, by having additional people, does that save money in some other way by people getting more expedited services, if you will?
I believe it does. I mean, they try to motivate people to get into services. There's a cost savings for people to be served in community services versus in the hospital and the jails. There's a cost savings in terms of, well, there's cost benefit to us if providers are able to use their time to do direct services. That means we have the ability to increase our encounters, which increases our revenue sources, which replenishes the fund to support these activities.
I'm not necessarily against this, but I guess 10 is so the doubling of that number is kind of surprising. That's like a 90% increase. And so what I'm wondering is if you want to stage into whatever the proper level is,
Mhm.
I don't want to go too far too fast. It'd be nice to, ease into the right number, but not surpass that. So what if you need 10, that's fine. But if you say you need 8 and you ask for 10 and you can get by with 8, we ought to.
Yes, we would,
Okay,
we
so I
would,
guess
we would fill them as there was need. We would not fill it if there was. I mean, that's just like anything. We only fill them once there's a caseload to provide to them.
All right, thank you.
One last question, Lindsay, this might be for you. Sorry, Tim, you might be able to help. Obviously, because the reimbursement rate, where the CCBHC model has done for ComCare has been quite significant. So there's a healthy fund balance right now, but there are pressures on this fund balance that you have advised us not to get all, I don't want to choose my words wisely, aggressive. Can you help us understand? I do agree that there's going to be a need here on your decision package, the level we'll talk about, but there's some pressures coming on that fund balance that we should not get aggressive.
Right, there are some pressures and then there's some uncertainty. So the pressures I would say include right now, we know that the commission has the Mental Health Association contract that was not included in the rebasing for those dollars. And so to the extent that contract, and I think it's in place through September, we're going to have a meeting, I think late next week, to have a conversation about what that contract looks like after that date. So depending on how that works out, that'll be some potential pressures on that fund balance. These positions are some of the discussion as ComCare, as the Community Crisis Center opens and their staffing needs that are there. We don't yet have I don't think we have a complete idea of what that looks like. So that's going to be a pressure that's coming within the term of this rebasing. We also know that one of the things you'll hear during your conversation next week, is a ComCare complex. Right now, the price tag on that is $39 million. We would anticipate that as much as possible would be repaid with of the debt service would be repaid with an annual installment, basically from the ComCare fund. So all of those are pressures that are coming in. Then in terms of uncertainty, depending on who you talk to and what news article you read at what time of the day, you can hear that there are some potential pressures on Medicaid, potential reductions. Depending on who you talk to, some people say that is a track that the Republicans may look at in terms of trying to do their budget bill. Other people say Republicans have abandoned that because it's an entitlement. that has been promised not to be touched. So there's just uncertainty. We don't know, we won't know for some time. So that's why I am saying, I don't want to go too crazy one way or the other on anything,
Sure.
just because there's so many pressures. So hopefully that answers your
No, it
question.
does. It helps.
And I
step
think
on the right.
one other pressure is our federal SAMHSA grant expires in September of 2026. So those positions will move to the revenue fund, and that's $1 million a year as
A
well.
million a year. Okay, that's helpful. I just wanted to kind of get the idea and wanted my colleagues to understand the landscape of what we're walking into. I think it's important. Okay, I think we're good. Joan, thank you. Appreciate
Thank you, guys.
Okay, I'm back again. But I wanted to mention that as we talk about the MAC services, care coordination is one of those things that we will be doing inside the MAC. And so those positions will help in that regard as well. But now I'm going to talk about aging and disabilities. And in terms of workforce strength, I think the best way to describe what's going on in aging and disabilities is uncertainty. Again, we talked about uncertainty, but lots of uncertainty within the aging and disabilities environment as well. I am happy to say that next week we'll be having interviews for the director position. So that's encouraging for me. But one of the things that we see on the workforce strengths, it looks pretty good. And one of the reasons that it looks as good as it does is because there have been some changes at the state level on who delivers some services. And so we're going through a reduction in force related to some services that had been provided across the state by the network of AAAs or area agencies on aging. And so the big part of the work that aging department does is through the AAA, the Central Plains Area Agency on Aging, and two different contracts for work that the statewide AAA network did have now been outsourced to companies out of state, large insurance companies, to be honest. And so that has resulted in a reduction in some positions that we have in the Aging and Disabilities Department. And those services will be delivered by those new companies starting next month. But we do have a good representation across the board there. The CDDO function, pretty small. And so when there's a single vacancy, it makes it look worse than it is actually. But again, they do a good job of finding folks as well. In terms of mandatory and non-mandatory, we've listed under the mandatory side, those are functions that are paid for with the aging mill levy that was voted on in 1982. And so we've identified those as something that's kind of voter directed, and those are the services there. And then at the bottom, we show the CDDO's responsibility as it relates to service capacity in the community and some of those crisis functions. And then you can see the PD work that happens within the Department on Aging and Disabilities is a non-mandatory function, but it's a critical function to that population. In terms of the SWOT analysis, again, specialty folks doing specialty work, there is a good management team in place. So the new director will have a lot of wisdom and experience to lean on as they integrate into that position. And we've got a good reputation in the community. We have partnerships across the board. Much of the work that gets done, as opposed to the work that happens at ComCare, where a lot of it is staff done. Aging and disabilities contracts out with lots of different providers in the community. There's probably 50 to 75 different providers in the community that are contracted with. That's the nature of that system and the way that system is designed, as opposed to the way the mental health systems are designed. So we've got those types of strengths. There is legislative support to continue to work on the IDD wait list. And so that is a strength, and that's really helpful. Now that creates a little bit of pressure on the network and making sure that the network is adequate and that there are providers in the community that can address those folks as they come off of the waiting list. There continue to be challenges related to some state funding as we look at those things. And then that has created some morale too, because as Joan mentioned, there's just a little bit of uncertainty among employees as they see functions go away or go to other providers. They worry about the viability of their position as well. In terms of opportunities, we continue to look at creative opportunities. The Department on Aging again received another award for innovation in the work that they do. They continue to come up with new programs to serve folks, and very proud of the work that they do. And then there may be some new opportunities related to fee-for-service delivery in that regard. So some partnerships with the VA and maybe doing some Medicare work as well could be opportunities for that department. And then one of the threats that we face is the ongoing aging of the population, and I'll admit I'm part of that group. And then the pressure that comes with the uncertainty related to funding. And then wait list offers. You know, it's great when we've got an opportunity to bring people off of the wait list, but there is a challenge to make sure that our network providers are able to help those folks as they come off. And then we've talked multiple times about the dilemma, the challenge that is faced by people that are experiencing both an intellectual developmental disability and a mental health condition, and the challenges they create for those service providers. And so we continue to work with partners at KDAS to try and figure out better ways to serve that population as well. In terms of the budget request, you can see that there, that it's about a 90%, 85% external funding, 10%, 15% coming from the general fund and aging services. And then the rest is grants and state contracts and that sort of thing. But again, a slight decrease. We're seeing the decrease primarily on the aging side because some additional ARPA funding that was available through that network has been exhausted. And so it's gone now. And there you can see how the money is spent as opposed to the ComCare budget, for example, where the bulk is in personnel. Here, the bulk is in contractuals. Again, that's providers to payments to providers for services they deliver in the community and across the network. There is one decision package in this regard as we've worked with the new finance grants compliance director. She identified and made a recommendation that we add an additional finance person. We have been able to look at some additional funding that has been made available through state contract, and we're able to add, with your permission, we would be able to add this position without an impact on the general fund. So there wouldn't be any local tax dollars for this position, but it would help with all of the financial functions, accounts payable, accounts receivable, particularly those that are caused by those grants. And so it's appropriate for the grant to be paying for that position as well. So we do have that one decision package. It's a $79,000 price tag. It's one FTE, no alternative reductions or revenue packages in that regard. Any questions about any of that?
All right, Tim, appreciate it. Commissioners, any questions? Chairman, yep, please.
Going back to your, well, I guess it's called slide number 22. You said that on the left side, there's a column that says mandatory, and then below that, aging in home services. You mentioned aging mill levy funds. Can you please be clear of that long list there? Aging mill levy funds, which parts of those, what part of that list is funded through?
Everything on the list.
On the entire left side of the page. Some of that has.
There are things on that list that are also funded by, there are federal funds, there are state funds as well. So nutrition's a good example there.
Right. I just say there's a mixture of funding for most of that. The only one I think is solely funded through aging mill levy is senior centers.
Senior centers is one, certainly. As I look at the list, legal services, I think we only fund with mill levy, and the low vision independent program is funded solely by aging mill levy. So there's A few of those in that list are only funded by the mill levy. And I guess to get back to the history, I think so. If you get back to the history, federal funding and state funding were originally the only funds that were available. So that 1982 ballot initiative identified and some local funding to fill gaps. And so that is, I think that's one of the ways to look at how the relationship between the Department on Aging and the CPAAA is. Again, most of the federal funding flows through the CPAAA, state funding flows to the CPAAA. And in the 80s, a decision was made that there needed to be some additional resources for those services to serve seniors. And that's where that aging mill levy came from. The Department on Aging within Sedgwick County was identified as a way to support that aging, the federal funding and the CPAAA. And so that's the relationship between the two. Now, there are a number of different services that are funded jointly. Again, that's to fill gaps. If the federal funds don't cover all of the need in the community. And when you think about some of the things that we talked about, nutrition, there's a lot of nutrition needs, and I don't know that any of the nutrition needs are ever going to be fully met, but it's a way to address nutrition needs, both with that federal funding and with the local funding that we've got.
Did the county have an aging department and an aging, aging programming at the county level before that mill levy ballot question was passed?
You're testing my history. I wish Annette was here today for this question, but I think the answer to your question is no.
Really?
Those services were provided by the aging, the Central Plains Area Agency on Aging. And I think in the maybe late 70s, early 80s, that moved from the city of Wichita to the county. And then we implemented that, the Department on Aging, as an administrative support to the AAA. And then those additional funds were identified through that ballot question and allowed to fill some of those gaps as well.
I have validated in the past, though, that Wichita did, because of the ballot question passed, Wichita shifted their support within the city of Wichita budget, I think, to other priorities, and they wanted the county, I guess, to backfill that with a tax that they thought was going to take over the funding, responsibility, so to speak. We know, do we have a list of how many nutrition programs we have that are kind of, there's numerous nutrition programs in this list of services, and they may have some overlap a little bit. I'm not completely aware. I'm not sure I could lay it out exactly how many there are and how they work. Can we have someone from staff work with me, help me understand that better?
Absolutely. Yeah, there are a number of different nutrition options in the community. The Department on Aging has funds a few nutrition programs. There's Older Americans Act funding that passes through the CPAAA to different providers. There are meal site locations. There are home delivered meals. There are lots of different meal options. And so we'll put together a summary for that.
That'd be really nice to see that, I think.
And help you see that.
And I'll just throw this out there. I mean, I'm not sure that my colleagues are interested in this or not, but I've got a lot of data on this topic that I've not shared it in a long time in a staff meeting or whatever, but I do have data going clear back to 1982 that I think is at least worthy of a 10-minute discussion at some point. I'd like to share some of that with my colleagues at some point in an open meeting, because I think the history of this is kind of important. I just leave it with that. I think this is one of those things, as a guy trying to cut the budget everywhere I can, and ultra conservative Republican, this is one of those things I do support. I think a reasonable funding to these things, because I see the mandate from the 1982 ballot question. If we want to not fund it, we need to put it back in the ballot and just get rid of it. The county's perspective is they only authorize us up to 1 mil. In fact, it limits us to not spend more than 1 mil. I think that's backwards. In other words, the ballot question, it wasn't a mandate to spend money. It was a mandate to not spend money. That's the current interpretation of that ballot question, which I think is exactly backwards. But all right, so I'd like to maybe share some data at some point before this budget process is over. Thank you.
Tim, just a couple quick ones. The decision package, it's an additional finance position. Is that housed here in your department or is that actually on site? How does that work? Go work for Michelle here or at Reagan?
This would work for the person that works for Michelle. This accountant function would happen in the department, but would report to the person
Okay,
that
that's
reports to
helpful.
Michelle.
And then we've talked a lot about start services and there was a grant from KDADS. I got an email that grant wasn't what we were anticipating that grant to be. Do we have is that going to prevent us from moving forward with start services or have you in all your brilliance come up with a different plan yet?
In all my brilliance, we're still working on a plan. We're not to the point where we want to say no yet, but we
Please
are.
don't. Yeah,
We've had multiple conversations with KDADS and we're trying to schedule another meeting next week so that we can further clarify what it is that they would expect for the reduced amount of funding that they offered us in that grant.
yeah.
Yes. Yeah.
Yeah.
And so we need to have a conversation with them to understand what it is that they would expect if we were to accept that. We need to make sure that we've identified any resources, additional resources that we can apply
Okay,
to it as
that's
well.
helpful. Okay, thank you. Commissioner Howard, yeah.
I'm sorry. On the sheet that we were handed on day one here, it is just curious. I think I understand how the process works, but the aging mill levy line, it's on line 6, line 44 on that sheet. If you look at the changing numbers going back to 2024, it was 0.385 and then last year 0.0372. Projected this next year is 0.0342. In other words, it's changing. In fact, it's actually going down a little bit. Can you please talk about how that number is derived to be on the sheet? What's the process to calculate what that number needs to be on this projection sheet?
So on this sheet, we are using that 28.701 overall mill levy. And then we're trying to draw down the fund balances in aging, highway, and bond and interest. You'll see they have a goal fund balance. We're trying to meet that by the end of the forecast. And so depending on where their level is, we try to draw them down gradually to meet that. And that's why that mill levy fluctuates between the funds.
We're planning to, and if you look at line 31, there's a reduction of $244,000 in that line. It's planned, I guess it's planned spending that's going to draw that number down.
Yes, we're trying to draw that down.
So is this generating the same revenue as 2025 using that fund balance? No, mill levy rate will change because of that strategy. But does that generate the same dollars as 25? What's the difference in dollars from 25 to 26?
Okay, on page 631, you can see aging and disabilities, their tax revenues, 25 revised is 2.8 million and 26 budget at this time is 2.8 million. Again, we don't have our values yet, so we'll have to wait and see what we get, and that could change.
You mean the assessed value?
Right.
I get that. That might change the mill levy number, sounds like, but will it change? It may not change the dollars. It sounds like the dollars is planning to be the same number.
That's our plan, yes.
And it's probably worth noting, and sorry to jump in, Maureen, we have given folks flat budget targets in their property tax credit funds. And so, but for any changes that the commission authorizes and those adjustments that would be made to personnel for compensation, we are expecting departments to live with flat budgets in their tax funds.
And I'll just say one more thing on that. Most of our agencies have lots of county employees, and we know there's raises built in, and there's cost of insurance goes up and other things. We have a lot of commodities and equipment we're purchasing, vehicles and other things. We know the cost is going to be higher because of inflation. A lot of these block grant funds, like these funds, there's a presumption that the outside the county umbrella, if you will, that those costs are static. There's no inflationary factor to them, which means because there is inflation, they're going to actually have less dollars to do work that they do, which means so the aging is interesting because we have an increasing population. People are living longer. If I have a chart that I would love to share with you all, it shows the age 65 and above going back to like 1970, all the way back to like 2060 or 2075. It's projected out, and the 65 and over population is a is the biggest change in that chart. Takes into population as well as longevity and then in terms of age threshold. So it's a really great chart. So what you see is increasing needs in this budget and decreasing resources because of inflation. So there's no recognition to that, which is a continuing problem because these services are feeling more pressure to provide more services. Yet they've got the inflationary pressures to somehow manage that another way. So there's competing lines, if you will. And actually I have another chart that shows the competing lines that I just think I'm not sure that I like the way we're doing this one. Thank you.
I think the challenge for the commission is going to be, if you look historically at what we spend on these services for aging and disabilities in 2025, between 21 and 22 million. The question for the commission is that enough? Or because of what some of the things Commissioner House said, with more aging population, more needs and services, is it not enough? And then you tell us and we'll adjust and we will manage the budget as you express, but that becomes the bottom line question.
Agreed.
I'll just say this. What that ballot question meant to me is that people said they wanted to provide some tax revenue to take care of seniors who have great, I'd say, socioeconomic needs. I mean, these are needs where someone can't get to the doctor or that someone is malnourished or their socialization is zero because they can't get out of the house or their home is unsafe for them and there's no way to solve those safety issues. This is the money is intended to help take care of those types of needs. And I think people generally support that for people who have great needs. It's not really intended to help people who can help themselves. It's really to help those people that are truly destitute and have no other great options. So this is why government provides services for the people who have great needs. And so I think that considering the wording in that ballot question, I guess I challenge myself to say, again, this is at the current year is projected to be 0.0342 mils. And according to the law, we can go up to 1.0. I'm not suggesting we would ever do that. I'm not advocating for a tax increase necessarily, but I am saying if I'm aware of these needs, what is the plan? Just to say we don't have the money, but we do have a mandate. We just don't have, we don't want to say we don't have the money. I have another interesting idea. I asked Lindsay before the earlier today, and I actually think what we ought to consider doing is potentially, I'm not sure if clerk would agree with this, but I wish that the mandated spending that the state forces us to do, and anything that's approved by the voters is a separate ballot question. We have two, WSU and aging mill levy. They ought to be separate lines on our tax bill. So when someone looks at the tax bill and there's a bond question for your school, it's understood that your school district boundary has a bond issue that the people approved. And it's for a purpose, for these buildings that you wanted to have built in your school, just like that. People voted for a mill levy to take care of our seniors. It should be a separate line that says Sedgwick County is a district and there's a mill levy. This is going to do exactly what you told us to go do. We can put it back on the ballot, repeal it. Okay, but as long as that is out there as a mandate, show that as a separate line. So it's not buried in our 28.701 mils. It's a different line. And this is the money we voted to take care of our seniors. So it's clear we're not simply, doing something because we think we want to spend more of your money, but you told us to do this. And there's a great need. So I would love to see that debated because I think right now our mill levy being all put into one number is very misleading and people don't know 1.5 mils is actually a separate line. So I think we ought to argue about how to change the way it appears on the tax bill.
They do that for junior colleges. So, yeah. Okay. Good point. Okay, I think that's it, Tim.
Okay, I am going to invite Chris Stewart with the Health Department to come up and talk about it.
Chris, welcome. We're glad you're here.
Good afternoon, Chairman and Commissioners. I'm Chris Stewart, Deputy Health Director. I'm subbing for Adrian Byrne today and will present the Health Department's 2026 budget. The Health Department Workforce Strength Chart shows most programs in green and yellow, and we continue to strive to become more green and yellow. And we're on a good path thanks to County Finance and County Human Resources. Any questions about this? Okay, The health department has two mandatory programs, yep, and some non-mandatory programs as well. The mandatory programs are epidemiology and tuberculosis control, and they are mandatory functions that the health department performs per state statute and regulation. For the non-mandatory programs, we have some that are fully locally funded and some that are local and grant funded. Any questions? For our 3-year horizon, I wanted to highlight a couple things. Wanted to highlight the strong experience and expertise that we have in our health department staff for non-mandatory and non-mandatory services. And as most of you know, we did report a measles case this week. And so that goes to show of our expertise with our epidemiology program and other staff at the health department that work very hard on reportable diseases, which is a mandatory function. One of the missions of the health department is to protect the public from health threats. And that is what we do, is we do disease investigations and make sure that contacts are taken care of and the disease does not spread. Another aspect of this that I'd like to point out is we have an overdose prevention grant. It's called Overdose Data to Action. And as part of that grant, we do work with ComCare and grateful for that to help the community. I'd also like to point out for opportunities, a 5-year project with IT to connect software applications for efficient workflows. That has been going great. So thank you to IT as we work very hard with vendors and internally to connect our systems. We also have weaknesses and threats that have been mentioned previously, difficulty in hiring mid-level providers and nurses due to below market wages. And our threat is the possibility of reduced federal grant funding. Any questions about these? For our budget request, in the budget summary, you can see there is a minimal 6.54% increase in the general fund. So half of this is the decision packages that have already been approved and the increase and the other half are tweaks in commodities and contractuals. So it's 6.54% increase for the general fund. The decrease in health department grants is mainly due to personnel changes, grants ending, and realigning of the health budget. The total 2026 budget is a 12.81% decrease from the 25 revised. And then on this slide, the budget breakdown indicates that personnel changes are the biggest driver of the decrease in the health budget. Small decreases in contractuals, commodities, and interfund transfers made up the rest of the reduction reflected in the 26 budget. And that's all. Any questions for me?
Thank you, Chris. Any questions?
Chairman, as always. I'm sorry. My head goes, I'm sorry. I feel bad. I need to apologize to everybody. 2 questions. Number one, do we know why is animal control under the health department? Is that by, it's weird to me that that's where that
I'm
belongs.
going to take that. Okay.
Begrudgingly, Tim walks to the.
I got duped. It's one of those departments that it's hard to place. And if you look across the country, it's in one of 2 places. It's either in the health department or in the law enforcement function of the age, whatever the agency is. And 10 or 12 years ago, animal control had been under the sheriff at that point in time. And I think the sheriff had felt like he had done his turn and approached the county manager at that time and asked if it could be moved somewhere else. And the health department was the winner in that request. But if you look across the country, it's not uncommon for animal control functions to be in health departments because of the relationship between disease and that sort of thing. So that's how it happens.
I certainly see that side of it, but I can tell you that when the animal control officer shows up out in the middle of nowhere, if he's a commissioned law enforcement officer, he's got a car with, lights on top, and he's wearing a uniform. He's got a firearm on the side of his hip there. I think at the end of the day, you get a lot more respect from people. And it just looks like, it just seems a little strange to me that someone's out there investigating, dog attacks or things like that. And they have to issue citations. But it's actually coming from health department when there's a citation that ends up in court over some animal abuse case or whatever. I guess I would just say, I don't know what the aversion was for having that under the law enforcement side, but I would, if I was creating government, I would rather see it there. I don't know if anybody else agrees with that or not. And my second question is this, give me an update on travel immunizations. Where are we on? Has anything changed? Are we still doing that same as we have, or?
We are. Yes, travel immunizations is still going on.
I haven't seen a report on how many travel immunizations we put out recently. Can we get a report, please?
Sure.
And what type and thank you. And I guess also the cost of what it is, it cost completely borne by the recipients? Or are
Yes.
we covering some of that?
Yes, no.
Thank you.
Okay, Chris, thank you. All our best, Adrian. Hope she gets feeling better.
Okay, thank you.
2 more slides. Summary slide, the 2026 request is $1.7 million. And the decision package summary again is ComCare with 10 care coordinators and finance with, or aging and disabilities, 1 finance position. But again, neither of those have an impact on the local mill levy. They're funded externally. So any other questions on anything?
I would just say that I heard rather clearly from you, Tim, and also from Joan and even Chris that, you know, the uncertainty on the federal grant level is, your staff is hearing that. And I want you to know that we understand that too. And this committee that's been established and the planning that we're trying to do to get ahead of this, I hope your staff hears loud and clear that we value what they do despite what's going on the grant uncertainty, that we know the work they do, it's valued, and we'll do our very best to make sure we walk through this with some sound logic and a real strategic plan. But we hear you clearly. We know that your staff hears it. So,
Thank you.
okay. Lauren, what do you think?
Okay, next we have the Division of Administrative Services will be on page 187 of your binder. And I think Tanya Cole is going to start us off.
No break.
Thank you.
We didn't have any break, did we? I guess, yeah, let's go.
Oh, that's perfect.
Hey, let's just, if it's okay, about a 10-minute break. That's okay.
Perfect.
So we say bye to some friends that are leaving and welcome some new ones.
187 for administrative services. Hand it over to Tanya Cole.
Hey, good afternoon, Chairman and Commissioners. Tanya Cole, Assistant County Manager, and so we'll be covering Administrative Services Division. Just a few things. I do want to introduce who will be speaking this afternoon. So we'll have Bo Bergeron, Fleet Management Director, Corey Stokes, who is the Central Services Director, Andrew Diltz, the Facilities Director. I will cover parks. And then what's missing on this is courthouse police. We do want to bring that back as a separate staff meeting with the sheriff and make sure that finance and human resources are part of that discussion because of the potential transition to the sheriff's office. One other thing I do want to point out that's not in these slides is Andrew had a cost of doing business. That's on page 3, and that is to cover the increase in utility costs, and that was about $228,000. That covers electricity, gas, water, and sewer. So if you need any additional information on that, Andrew will be sure to cover that under his slides. So we're going to start out with fleet management and Bo.
Hey, Bo, welcome.
Morning, afternoon.
Yeah.
Bo Bergeron, Fleet Management. So currently we're at full workforce. Haven't been that way in a long time.
Good.
Our services mandatory, we have KDHE, which is our underground storage tanks for fuel, all the fuel stations, and also our waste oil. And then KDOT is registration for vehicles, compliance, all that. Non-mandatory, management of fleet services, overhead for fleet services, fuel and fuel services for divisions, vehicles, vehicle replacement, preventative maintenance, county vehicles and equipment, repair and maintenance for snow removal. That's separate because we do on-calls for snow removal stuff, body damages, and manage funds for the sheriff airplane. Strengths, we're at full staff. We have a knowledgeable and veteran staff. Weaknesses, with all the new technologies coming out, we constantly need training for vehicles and different systems. Our opportunities, we're working on acquiring more shop tooling and equipment to do more things in-house, cylinder repair, other maintenance. We had a alignment machine a couple years ago that was approved, which has done really well. And then more training on specialty systems for in-house repairs. Threats, the usual stuff: increased cost of parts, cost of vehicles, increased technology in vehicles, and then the possibility of tariffs. Our fund, 12.2, reduction of 0.41. And there's everything else. Down and dirty.
Yes, it is. Okay. Any questions? Please.
I think I asked this when I toured with you, but how many non-emergency vehicles, so no sheriff, ambulance, anything like that, but how many vehicles do we actually have on fleet?
So take out emergency services vehicles, probably around 400, 350.
What divisions use those? I think of probably Lynn having quite a few, but
Yeah.
what
So
positions drive those on a daily? How many of those go home? Do we have that information that is
I don't
easily-
have all of it on me, but I
But
can
you
get
could-
it.
Okay.
But I think there's 9 different departments that have vehicles total.
Okay.
So probably 4 or 5 of them. Health Department, Public Works, MABCD. Yeah, there's a plethora.
Okay, thank you.
Okay, good question. Any other questions? Okay. Thanks, Bo. Hey, Corey.
Good afternoon, Chairman, Commissioners. Corey Stokes, Central Services. As you can see by the workforce chart, we are 100% manned. The department consists of records management, which is governed by state statute. And our non-mandatory is a mailroom, print shop, and 2 call centers, all of which support internal functions. Some of our strengths. Over the last 3 years, we were able to stabilize personnel. We had a influx of those leaving and coming in, so now we're pretty stable. We continue to develop a training plan for our call center and our print shop reps. Some of the opportunities, we have an opportunity to create a quality control program within central services to ensure we're giving out accurate information and timely information to callers. And some of the things that I'd like to do, I don't know if it'll be feasible, but I'd like to do it, is examine how we can use different technologies to aid in that response. One of our biggest threats, and as I'm sure with everywhere else, is a loss of personnel. We are, I'll call it tight knit. A loss of one person is a major reduction in service. So that's a major threat to us. And with employee burnout and employees taking leave to recoup, we feel that reduction. Overall budget request for 2026, we're looking at $2,872,000, which is a decrease from previous 2025. This is the breakdown of what we are looking at. And I think I've clocked in shorter than both. Any questions?
Yeah. Any questions for Corey? Always good work, man. Thank you.
Thank you.
Andrew.
Hey, good afternoon, Chairman and Commissioners. Andrew Diltz, Director of Facilities, here to present the Facilities Department budget development page. So we are basically fully staffed across the board. We do have vacancies in the maintenance area, but everywhere else we're fully staffed. Here are a number of mandatory services. ADA is a big one, City of Wichita inspections, and State of Kansas, multiple agencies there that oversee or have requirements for the operation of our facilities. We do have a number of non-mandatory items or services that we perform, range of pest control, hiring vendors for safety, performance, overseeing remodels, construction, that kind of thing. So we all know what would happen if we weren't doing pest control. So it's not mandatory, but it kind of is, right? For our strengths, I want to thank everybody in this room. I think a lot of people here contributed to us having competitive pay and being fully staffed in the areas that we are. So, and in our maintenance area, we've really climbed a lot significantly over the last few years as well. Some of our strengths, we have an arsenal of on-call contracts. We can depend on contractors if we need outside help to manage any emergencies or anything that we have there. One thing that I think we really pride ourselves on is when we have an issue or a maintenance concern, we try to look at all angles when we're evaluating it and making the most efficient repair and decision going forward to provide the longest benefit to the asset as well as the staff that are being benefited from that asset. We do have opportunities. We're always constantly looking to improve just about in everything that we do. We do have a few weaknesses regarding equipment obsolescence. We have a couple of positions that are very difficult to fill. We do have a threat we have a federal grant that's helping us with one of our maintenance projects, hoping that stays. And then we're battling with tariffs and rising cost of construction costs and labor. Here's a summary of our funds. Overall, our 2026 request is for just over 10 million, a decrease of 35% from last year. Here's basically same summary. And I'll stand for any questions.
Will you go back one slide real quick? I want to see where that general fund decrease is coming from. Go back forward one more. Sorry. There you go. Interfund transfers.
So I'm going to say that's probably capital improvement projects.
That makes sense. Perfect. Okay. Any questions?
And commissioners, I don't want you to get your hopes up when you see your CIP presentation next week, we're gonna more than make up for that decrease in terms of, you can shake your head at me all you
Thought
want.
we were canceling CIP.
Yeah, okay. Dream a dream. Dream a dream, guys.
Okay, Tanya,
And if you'll recall, last year we actually went long.
we did. It's big. I was kidding, Lynn. Well,
We were going to talk about.
yeah. Okay, Tanya Parks. Aaron's gone.
Yeah, covering parks. So you see a little bit of yellow and green. Basically, that's just one position, and that's the park superintendent. So you're seeing yellow in Sedgwick County Park and Lake Athens Park, and that's his position. That covers both of those parks. So you'll see mandatory, non-mandatory. The amenities that we cover in the parks is basically non-mandatory. So everything that's covered from fishing, camping, playgrounds, walking, all of that stuff is non-mandatory. So strengths, that should basically say almost all positions filled. We do have experienced, knowledgeable admin staff. We do have a dedicated team in our parks that do care about customer service for those that are visiting the parks. Weaknesses, we have 9.8 FTEs in the parks that do take care of the parks. That's about 1,800 acres between the three parks. They do that, of course, with lean operations, and so that leaves very little room for error. Opportunities, we have been presented just recently with an opportunity to work with the city of Wichita to provide more programming and services within our parks. So we're looking forward to that, as well as what I'm really looking forward to is seeing what happens with the master plan within our parks. So looking forward, that'll come back the end of May. So looking to see what that will look like. And then threats, similar to what Andrew mentioned, just increasing cost of equipment and materials, aging facilities and equipment. And then just something that we, see on a regular basis is just, increasing vandalism and and theft at our parks. So we try to kind of express, ownership of our parks. We do that. We did that last year with, I can't remember exactly what we called it, but it was just a day of service at our parks. So we'll continue to do that. So general fund and then special parks and rec fund that we have for a total of just over $1 million is our budget request. And then there you'll see the personnel, contractuals, commodities, again, just a little over $1 million. You do see that there's a decrease in contractuals and commodities, and that reduction is just from the master plan that we did have this year of 50,000, and you'll see that reduction in there in contractuals and commodities. Okay, so we do have a decision package and an alternative reduction package, and I kind of want to talk about these together. And I will be very honest with you, it's really just a cleanup in our staffing table. So what we want to do, and I'm going to talk about the reduction package first. What we're trying to do is basically take out 2 part-time maintenance staff and a part-time camp host. We want to take that off of our staffing table and add in 3 seasonal part-time staff. And so the reduction is a total of 48,000, and then we're adding in a total of 54,000. And again, this is just to better equip us with what we need. We need the seasonal workers. That helps us for 6 months out of the year when we need them, which is really May through September. That allows us to work them 40 hours a week. And then just take off the part-time maintenance staff, and then take off that part-time camp host that they haven't filled in probably 3 or 4 years. So really, it's honestly just a cleanup, and we've worked with HR for that. So happy to answer any questions regarding parks.
Oh, just a quick question. We're park superintendent is no longer with us. So are you going to post that position? Are we going to wait, or what are you thinking here?
Thank you for that question. It is posted. We are getting ready to close that position and start interview process.
Okay. Other questions, Commissioner Howe?
Thank you, Chairman. Just when you say 40 hours a week, but they're 6 months, do they receive benefits during that time?
They do not.
Interesting. So are they held to the 1,000-hour limit per year?
They are.
Okay. I guess I didn't know you could work 40 hours a week and be non-benefit. Okay, that's news to me. The Lake Afton store,
Mhm.
is is it profitable or is it cost taxpayer money? What's the profit loss of that store?
Well, my understanding is the revenue that they bring in basically offsets the expenses of what we get from Lake Afton store. But Lindsay, I see you kind of looking at you. Do you want to answer that a little bit better for me? Okay.
So if you go to page 6, oh man. 698. You can see kind of what that looks like. It slightly exceeds, in the last 2 years, the costs have slightly exceeded revenues. But in the budget going forward, based on how the costs are planned to be distributed, it will more than cover the costs of the staff to maintain that store and the commodities.
Have we adjusted our rental rates for the facilities at these parks?
We did. If you recall, I think it was just this last summer, we increased the rental rates and the camping and all that.
We've seen the utility of the usage rates change as a consequence of that.
I don't know if I've gone back and did a study on that, but we'll go back and do that.
Lindsay, what's the high level math on revenues coming into offset costs?
So in this current year's budget, because there's no CIP, we have about a $1.1 million general fund budget in the parks, and we are planning to bring in more than $500,000. So the county subsidy in that perspective is about $500,000 then. So it's truly $500,000, which is what, 1/14 of a mil? So pretty good.
The ball fields over by the zoo, that's, I guess, there's a leased out. Does the county have any costs for any of that property over there at all?
No,
Is a lease payment?
it's exclusive to the leasing of that particular ball field.
Does that lease, there is a lease right there that
Correct.
brings in, where does that money go in the budget?
Lindsay, you might have to help me on that.
We don't actually receive very many revenues for that, but it would go into the parks budget if there was any. But I think there's what, $3 $1 leases.
There really isn't any substantial dollars at all.
No. But they pay for all of that.
Mhm.
They pay to maintain, they pay to do the capital improvements. We don't have to do any of that, so.
The maintenance as well. I think.
And there still is, and there a little bait shop or store at Sedgwick County Park. I know it was years ago, maybe.
No, that's closed. Yeah.
Sedgwick County Park.
Yeah, he's asking about Sedgwick County Park. That's closed.
Yeah, that's what I thought. Thank you.
Well, since Commissioner Howe brought it up, I mean, West Urban and TRYC, I would love in that master plan for them to consider maximizing what that is over there. Actually, well, it's neither here nor there. I just think there's a real opportunity for the city of Wichita and for the Wichita community to maximize what Goddard is doing, what Derby is doing, what Park City is getting ready to do. I just think there's a real opportunity there. So I hope it's included in the parks plan. Okay.
Okay.
Thank you, Tanya.
You bet. Just quick summary slides and I can go super quick. Division summary, all of those departments we just discussed, 26.2 million. Again, those packages that we discussed, the reduction and the addition. That's all I've got.
Wow, that was nice. Good job, guys. Appreciate it.
Thank you, Commissioners.
Thank you.
Okay, we have.
Hi, Lauren.
Hi. We have one more presentation from the week. It's page 119 for our county appraiser, Mark Clark.
Here he comes, Mark Clark. Bonnie Tidwell, deputy appraiser, is also with him. You say that page one more time again? Thank you. Name the city. Come on.
Good afternoon, Commissioners.
Okay, Mr. Clark, good to see you, sir.
Hello. Commissioners, how are you today? There we go. This is the Appraiser's Office 2026 budget request. Looking at the workforce strength, we have 70 FTEs. We have 65 filled, 5 are vacant. That's a nice 93% strength. There are 5 divisions: administration, land records, residential, commercial, and special use. If you look down below, you see the grid, and that tells the positions. Some of them are being onboarded very soon. And if you look, the land records have 1 vacant, and that is going to be onboarded May 19th. Residential, 3. We have onboarding going on the 12th and the 19th. 1 to be determined. That's still an issue, but we're going to get that filled very soon. And then if you look down at the bottom of special use 1, that person is in residential and is moving down to personal property. So that position in personal property will be onboarded on May 12th. Now, this here it gets interesting. The Appraiser's Office strength, years in office. We have the 5 vacants, which makes up 7%. 3 years or less, there's 23 employees, which make up 33%. 3 to 5 years, there's 9 employees, making up 13%. 5 to 15 years, that's 13 employees, that's 19%. 15 to 20, that's 7 employees at 10%. 20 to 25 years, that's 3 employees at 4%. And 25 or more, that is 10 employees at 14%. However, if you look at it years in position, this shows that we're pretty green. And 3 years or less, 43 employees at 62%. Vacant, 5, 7%. 3 to 5, 14 employees at 20%. 5 to 15, 7 employees at 10. And then 15 to 20, you have 1 employee for 1%. When it comes to the Appraiser's Office services, they're all mandatory. None of them are not mandatory. And all of that is spelled out in the appraisal maintenance specifications, of which we recently had a staff meeting on, and the director of PVD was going through some of those. Now, if you look at SWOT, Appraiser's Office strengths, weaknesses, opportunities, and threats, I'm not going to go over all of these. I'm just going to highlight a few. But in the strengths, training and educational development plans. Whenever somebody is hired, of course, we want to get these people as competent as quickly as we can. And we have educational plans starting right from the beginning. And those plans follow them all the way through their career life in the appraiser's office. Continued success of substantial compliance. We are A-rated. I believe that we're going to be A-rated again this year. I'm looking at a higher score, and I believe that's going to happen. Strong leadership, you don't have an A rating if you don't have strong leadership in the office. When it comes to opportunities, legislation, the elimination of certain personal property items allows us to reallocate that staff to where they're more needed in the office, and I hope we're allowed to do that. When it comes to modern and updated software, we do now have Apex 7. That is sketching software, and we are required to sketch all improvements on properties. So that is a necessity. SPSS, statistical software, we have version 29. We'll be completing our Office 365. And then also, you see in the second bullet there, income modeling inside of Orion. We do most of our commercial valuation outside of Orion, and then we have to put it in. We've been working very closely with Wyandotte and other counties that have developed some solutions. PVD has approved those. PVD has been putting some of that into our Orion system, and we believe that is going to help put together parcels so that we can value and try to eliminate some of the multi-pin valuation issues that we have currently. That's a start. Weaknesses, office space. I'm asking for people. I'm out of space, but I'm still asking. Sales ratio compliance. Bottom line is we've had issues there, but we are getting better. And from everything that I've seen in the mid-year, it looks promising. It looks quite good. I'm just hoping that nothing towards the end hurts us, but we will know in September or late August, excuse me. Threats. When you look at legislation, once again, legislation can also be a threat. When you're tracking multiple values in a capped environment, that can cause problems. So in the current legislation, or how it was proposed, you would track the 4%, you would track the appraised taxable value, and then you're going to have to track an assessed value. And there's going to be some cost to that. It won't be to the county. A PVD is going to have to cough up the money for that. But nonetheless, if anything like that were to happen, those changes would be covered by PVD. And then, you know, I prefer not to have capped values. I'd rather have a levy lid. But, you know, beggars can't be always winners. So the next threat is retirements. 9 staff eligible in the next 3 years. The bottom line is holes in the workforce. It's hard to achieve sustainability when you have holes, and also you need, if you're going to have a good appraiser's office, you have to have a strong working knowledge base in the office. And if you're losing people like that, that really hurts. Let's look at the summary of all funds. Basically, for 2026 requested $5,930,548. That is a 3.04% reduction. And that reduction, it's my understanding, is based on pay adjustment and benefits. We don't have a reduction package. I'm sorry to tell you, but I really don't. But I do have a decision package, and I am requesting 9 additional full-time positions in 2026. Additional personnel are needed to keep up with statutory requirements, service levels, and industry standards. I think it's important to have a work-life balance. We'll get to some things in a minute where you will see some of the workload is actually quite crushing. So, and it's very demoralizing. So, but nonetheless, they've done a good job. And in the appeal season, they have really done very good. So new additional requirements and changes to existing requirements that we have to follow, that also impacts the staff. So we need a little bit of help. And so the request is for $716,135, 9 additional FTE positions. If you look at the positions, these are in priority order. That's the order in which I'd very much like to have positions granted. Not to be a pig, but I'd like to have all 9 if I could. When we, let me here, once again, 716,135 for 9 permanent FTEs. We're going to flip right. Okay, now we are looking at parcels for 2025, and the current number is 236,175 real property parcels. The number of parcels just continues to increase. More work for staff. Personal property accounts. As you can see, it fell for a while from CIME and other accounts that were exempted. And then it bounced back with watercraft and airplanes and just personal property of various types. However, for 2025, it is 36,500. When we go to parcels per staff, now this here is interesting. IWO standard says that a county our size should have 2,700 real property parcels per staff member. We have, and if you take the 236,175 by 70 FTEs, you wind up with 3,374. That is a lot of work for staff. We look at total accounts per staff. You have 236,175 real property, 36,500 for personal property, for a total of 272,675 accounts. IWO standard is, for a county our size, 3,000. And that is by 70 FTEs, 3,895. Now we're going to look at something that commissioners usually like to glance at, and Lindsay usually does cartwheels over. So I don't know if she's going to do any cartwheels today. Nonetheless, we'll just pick out a few things here. Parcels and staff, and I'm going to focus on Sedgwick, but the large county comparison is for Johnson, Shawnee, Douglas, and Wyandotte. Parcels per staff, 3,326. Total account staff is 3,901. You look at the total ag acres, that's always fascinating to me, that we still have 67.1% of our land is devoted to ag use. Then if you flip the page, you will see residential parcels divided by residential staff. And remember that focusing on Sedgwick, we have 28 residential staff. That's 10,586. That far exceeds any of the other counties. Commercial parcels by commercial staff, 1,756. It exceeds the others. Personal property accounts by personal property staff far exceeds the others. And then if you look at the personnel portion of the budget divided by the staff, that is by far the lowest. Now, let's look at some more things on the large county comparison, 2024 total assessed value, looking once again at Sedgwick, but the other counties are there as well to look at. Value per capita, we're in the middle. Average county levy, we're the second lowest. And tax per capita, we are the lowest. Then, just for an interesting exercise, we look at the surrounding counties. Sedgwick, Butler, Cowley, Sumner, Harper, Kingman, Reno, Harvey. You look at the last three, value per capita, we're in the middle again. Average county levy, we're the lowest. And tax per capita, we are the lowest. Commissioners, I'll stand for any questions.
Okay, that's really interesting data. Appreciate that, Mark. And hey, commissioners, any questions? I think as we process through, I'm going to try to dig in a little bit to the 9 requests and the difference and what that is. And I appreciate you put it in priority, but I'll be reaching out directly to try to understand how hard it is to staff some of those positions. I think some of those, a lot like we've seen ComCare and other places, it's just posting the position isn't that easy. I mean, there's some skill set required. So I want to try to understand that a little bit better, but I'll reach out there and as we're processing the decision package, but it's a lot of data right there and I appreciate the work you do. Any other questions?
On your tax per capita, is that downloaded data from the state or did you calculate that number?
That's from the state. That's from the state.
State tables. Okay, and that's dollars per person? That's how much
Population, yes.
the dollars per people, and so the number of people in the county divided by, and the tax dollars is total taxes collected for all jurisdictions?
Yes.
I guess I'll go back a couple of slides here. On the total eight, I guess it's on page slide 19. On the total ag parcels, we have a lot more than every other county there. What's the does the appraiser's office actually do the same level of how much time it takes to appraise an ag parcel versus let's say other types of parcels? I assume that they don't take as much time because they don't change size.
They don't
And it's
change
based on-
size, but
and
there's a lot more different kind of work to do. They have to work with Water Resources Department in Topeka. They have to account for the well depths. They have to do soil delineations, things of that sort. So they're doing different jobs than the other appraisers, but it is detailed.
I guess what I'm saying is that whatever the details are of that ag parcel, those details don't seem to change except for if I understand correctly, you average, I don't know the formula exactly, but you average out the profitability or the profit versus the loss over a number of years. And that feeds into again, if it's cultivated land or whatever, it feeds into the formula on how that is appraised. So it's formulaic more than conditional or observable things, if you will. And the other data that you have on there is basically static data. So I'm just wondering, does it take, I know, I'm not saying it's not easy.
Right.
I'm saying, I'm sure, I'm not saying it's not difficult. I say it that way. What I'm saying is the counties are drastically different on the number of acres, the number of parcels that are ag.
Correct.
Second thing I have a question is, go back to your parcel count. I'm just trying to extrapolate the numbers on your page here a little bit because it's hard to tell exactly. You didn't give us actually the numbers, the bar charts. Slide 15. I would just say, again, the biggest change appears to be on the 24 to 25. Numbers kind of ramp up. I mean, the last few years, it's gone up quite a bit more per year.
Right.
How do we end up with again, I'm just going to throw a number up, roughly 3,000 more parcels in one county in 1 year? That's a big change in number of parcels in 1 year. How does that happen?
Well, I mean, you have lots of plats that are coming through now, new developments, and you have the economy, people are growing. I mean, so you have things going on in this county that are very promising. It's very good. And there are people that I know that will say, well, I wished it was better. And the guy's making 2 new developments. I mean, things are pretty good. I mean, I hear people talk this place down, but there's people making money here.
What I'm saying is to to take a property and to make more parcels, you're subdividing that property, which means I assume that means it's going through a plat process.
Right.
And so I guess I'm just saying 3,000 in 1 year. That's a lot. I guess I'm just not aware that there's that much.
But there
change
is,
happening.
there really is.
All right.
Commissioner Howell, in 2024, there were 4 plats alone that were over 400 parcels each inside the city of Wichita. So that's 1,600 parcels right there. So far for 2025, we've had the Yellowstone plat was just done, and that was 436 parcels. And another one just came through today to our land records appraiser. That was another 386 parcels. So we are seeing some pretty large plats come through that are having to be worked.
Thank you.
Good info.
And we've already been told by the county clerk's office that there will be other large plats. So 3,000 parcels in these last year, this year, and probably for next year. That's not going to be, it'll be larger than it was this year.
Okay. All right, Mark, Ronnie, thank you so much. Appreciate it. We'll process through this. We'll probably a follow-up on the decision package since there's 9 positions so we can understand it, and we'll get with you, Sheena, and then get with Mark and try to figure it out. Okay.
All right, thank you.
Hey, thank you. Lorian, what do you know?
That's it. We're halfway through at the end of the week. We have 3 days. Next week, we'll be back 1:30 on Monday afternoon.
Okay. Everybody have a good weekend. Sir, we done? Well, we do